June 1, 1885, a physician in a bustling New York clinic wrote in his ledger, administered 3 grams of cocaine to a morphine-addicted patient. The man woke, smiled, and proclaimed he felt as if a devil had been exorcised from his veins. Within weeks, that single sentence would echo through hospitals, lecture halls, and newspaper columns, heralding cocaine as the miracle cure of the age. The story of cocaine's rise in medicine began long before the clatter of typewriters and the hiss of early anesthesia machines. In 1859, German chemist Albert Niemann isolated the alkaloid from coca leaves, naming it cocaine after its source. By the 1860s, European physicians were experimenting with the powder's potent stimulant properties, noting its ability to dull pain, lift mood, and, most intriguingly, counteract the depressant grip of opiates. When the American Civil War ended, the nation faced a new scourge, morphine addiction, rampant among wounded soldiers who returned home with a dependence that doctors could not easily treat. Into this vacuum stepped a young Austrian neurologist, Sigmund Freud, who in 1884 published his seminal paper, Über Coca, on coca, extolling the drug as a wonderful and harmless stimulant capable of restoring vigor, enhancing cognition, and even curing chronic ailments ranging from headaches to depression. Freud's glowing endorsement sent a ripple of enthusiasm across the Atlantic, and by the late 1870s, cocaine had already found a foothold in dental anesthesia, ophthalmology, and most controversially, in the treatment of addiction itself. In the United States, the pharmaceutical boom of the 1880s turned cocaine from a laboratory curiosity into a commercial commodity. The famous Cocaine H tablets, marketed by the Cocaine Company of New York, promised relief from neurasthenia, neuralgia, and all forms of nervous exhaustion. Doctors, eager for a panacea, began prescribing small doses to patients suffering from migraines, fatigue, and, most dramatically, to those trapped in the grip of morphine. The dosage charts of the era read like a litany of hope: 5 grams for a headache, 1 gram for chronic cough, and up to 5 grams for severe opiate withdrawal. The most publicized trial of cocaine's curative claims unfolded at the Manhattan Hospital for the Insane in the spring of 1886. Dr. Henry H. Smith, a charismatic neurologist, enrolled 20 patients with documented morphine dependence. Over a fortnight, each patient received a measured dose of cocaine, beginning with a modest 0.5 gram and gradually escalating to 3 grams as tolerance developed. The results, recorded in a hastily typed pamphlet titled "Cocaine as a Remedy for Narcotic Addiction," were astonishing. 12 patients reported a marked reduction in cravings, 5 claimed complete abstinence, and only 3 experienced severe side effects, chiefly nausea and agitation. The pamphlet's bold claim, "Cocaine, the antidote to opium," swept the nation, prompting newspapers to brand the alkaloid the miracle of modern medicine. Yet beneath the headlines, a darker narrative began to unfold. Among the trial's participants was a 34-year-old laborer named Thomas Green, whose addiction had spiraled after a battlefield injury. On the 9th day of treatment, Green's heart faltered. He collapsed in the ward, his pulse erratic, his skin pallid. Despite frantic attempts at resuscitation, he died within minutes. The attending physician, overwhelmed by the sudden loss, called in a medical examiner to determine the cause. The autopsy, performed by Dr. William H. Larkin, revealed a heart enlarged beyond normal dimensions, with signs of myocardial fibrosis, a condition that, Larkin noted in his report, could be precipitated by the sustained stimulant effect of cocaine, especially when administered in high, unregulated doses. Blood analysis, a rudimentary affair by today's standards, showed an elevated concentration of cocaine metabolites, confirming that the patient had received a lethal dose. The report, published in the American Journal of Pathology in October 1886, warned starkly: While cocaine may alleviate withdrawal symptoms, its cardiotoxic potential cannot be ignored. The green tragedy sparked a fierce debate in the medical community. Advocates, such as Dr. Smith, argued that the fatality was an isolated incident, a mishandling of dosage rather than an indictment of the drug itself. Critics, led by Dr. James W. Davenport of the New York Medical Society, pointed to the autopsy's findings as evidence that the drug's benefits were outweighed by its inherent dangers. Editorials in The Lancet and the New York Times began to juxtapose the early euphoria with cautionary tales, urging physicians to temper enthusiasm with rigorous clinical observation. In the ensuing years, regulatory responses slowly emerged. By 1890, the United States Pharmacopoeia listed cocaine as a controlled substance, limiting its availability to licensed practitioners and mandating detailed record-keeping of each dispensed dose. Pharmaceutical firms, faced with mounting scrutiny, rebranded their products. Cocaine became an ingredient in coca wine tonics, coca cream, analgesics, and coca chloride eye drops, each marketed with increasingly discreet language. The medical community's relationship with cocaine shifted dramatically in the early 20th century. The rise of safer local anesthetics, such as Procaine, Novocaine, in 1905, rendered cocaine's anesthetic use obsolete. Simultaneously, the wave of addiction scandals, most famously the cocaine epidemic, among elite society circles in the 1910, prompted federal legislation. The Harrison Narcotics Tax Act of 1914 placed stringent controls on cocaine, effectively ending its legal medicinal use in the United States. Yet the legacy of the 1880 miracle cure era persisted in the annals of medical history, offering a cautionary tale about the seductive allure of a single pill solution. The episode reminds us that even the most promising compounds can harbor hidden perils, and that rigorous scientific scrutiny must accompany every therapeutic breakthrough. Subscribe to the Autopsy Files for more stories like this.